Going to introduce to you here now Cherie Peters. And Cherie has dedicated her career to organ donation and kidney health after losing a close friend to organ failure in high school. Her degrees are in communications, media, journalism, public relations from Indiana University of Pennsylvania. And she's worked with organizations like the Center for Organ Recovery and Education, the National Kidney Foundation, and is part of the UPMC kidney transplant team, where she now serves as the living donor liaison. Beyond her professional work, Cherie is actively involved in nonprofit initiatives supporting transplant patients and donors while residing in the Pittsburgh area with her husband and her two sons. So, Cherie, please enlighten us with your information. Thank you very much for being here today.
Absolutely. It is a pleasure. I am just trying to share my screen now, so hopefully this works. It looks like it did. Good morning, everyone. I am thrilled to be here to talk with you about all things kidney related. I'm honored to kick off this meeting. Thank you so much to the Kidney Stories Toastmasters for coordinating this fantastic event. So I work at a transplant center in Pittsburgh, and every transplant center has a bit of a different way of doing things. So this is not necessarily universal, but I think there's a lot of overlap between transplant centers. It's wonderful that we also have Anne up next, who can speak more from a national perspective, but hopefully there are tidbits here that are helpful to you. So kidney transplant is the best treatment for kidney failure. But unfortunately, not everyone is a candidate for transplant, and that's why centers must carefully evaluate anyone who is interested in a transplant to make sure that it is their best option. So we need to know that this surgery, that undergoing anesthesia and having a major surgery is safe for you. We need to make sure that you're going to have a longer life expectancy as a result. We need to have a plan for your care afterwards, so caregivers and a transportation plan so that you're successful. And you also need to really fall in line. You need to listen to all medical advice, get all your lab work done. You need to be willing and able to take all your medications. All of you who are post-transplant know that there's upkeep that needs to be done. And so we need to make sure everyone's on board before transplant. So the UPMC evaluation day is a bit of a marathon. We would have you go into a room at our clinic, and then all the different members of our team would cycle through to have a one-on-one consultation with you. Also that day, we're performing a bunch of different tests. We're drawing a lot of different tubes of blood. That we're trying to get everything crossed off the list so that we can finalize that evaluation. Also, a person needs to be cancer-free before moving forward with a transplant. Our team meets every Wednesday afternoon to discuss anyone who's finished their evaluation, and there are three possible outcomes. One is that a person could be declined, that transplant is not their best option. Another outcome is that you could be deferred. We need more information, so we don't have an answer quite yet. The third possible outcome is that you are medically approved, everything looks great on our side, and at that point, we'd send the information along to your insurance provider for their authorization. Of course, we know it's not as simple as just getting on the list, right? It is a huge challenge to actually have a transplant because the waiting list is massive. We have more than 90,000 people waiting for a kidney transplant. So why is that? Right? Because we have people who pass away every day. Why do we have such a waiting list? And I learned back in my organ procurement organization days that it's very rare a person can be an organ donor. In order for me to donate my organs after my death, I need to be in a hospital and on a ventilator. And that only happens in about 3 out of every 1,000 deaths. Beyond that, there needs to be consent for donation. And that usually happens in less than half of all cases. And so now we're talking about 1 out of every 1,000 deaths that leads to donation. Now, I hope at this point you've already heard a great deal from your transplant center about living donation. This is the absolute best option for anyone who's in kidney failure. And we bring it up all the time because there are so many benefits. You have a longer life expectancy if you have a living donor compared to a deceased donor. Your transplant can happen when you are at your healthiest. We skip around that massive waiting list. You have a scheduled surgery, okay? So you're not waiting by the phone, hoping for the call. Instead, we pick a date that works for everyone, and you can plan around that. Also, every time somebody finds a living donor, it shortens the wait for everybody else who needs to have a transplant. So you're not only helping yourself, you're helping a peer who's in that same situation. And lastly, but I think maybe most significantly, these are the best quality organs that you're going to get. They are from a person who is in excellent health. We have our donor and our recipient in neighboring operating rooms. So when we remove the donor's kidney, it goes right next door into the recipient who already has their abdomen open. They're ready, waiting, ready to go. And so we move the organ from point A to point B. And that's why these living donor kidneys tend to last about twice as long. Okay, they're not sitting in a cooler full of ice for the better part of the day. They are really happy kidneys. So the best hope of having a transplant is to find a living donor. We simply do not have any guarantee that a deceased donor organ will become available in the time where you need it. Now, I work with a lot of people who do not have family or friends who can donate, but they still find a living donor. They've gotten really creative. And so actually the National Kidney Foundation did a massive study on this, and they found that there are 3 key things that our successful people who find a living donor have in common. So they share their story with a bunch of different groups of people. They use a lot of methods to put the word out there. They also never give up. It can be discouraging when you're putting the message out there and it's been a few months and you're not hearing anything. Don't give up. Keep planting those seeds, keep growing momentum. We never know when the right person's going to receive that information and step forward. Now, nearly everyone I talk to tells me that they don't want to ask people for a kidney. I don't blame them. I would not feel comfortable asking somebody for a ride to the airport, let alone an organ that they are currently using, okay? So around here, we do not ask people for organs. We have another script that we use that's more of an update. So we encourage our people on the list to say something like this: I need to have a kidney transplant, and living donation's the best option. Here's a card with some more information on it. I'd really appreciate it if you could help me spread the word. And the beautiful thing about this is you don't need to do it alone. Now, as you're putting it out there and people are saying, oh my gosh, I'm so sorry, what do you need? How can I help? We have an answer for that. Actually, you can be a living donor champion. You can help put the message out there. You can email your coworkers. You can hang up a flyer in your break room. You can like and share my posts on social media. There are so many ways that they can put the message out. Now, one thing that makes us unique at UPMC is that we have dedicated staff members who work with people on the waiting list, both for kidney and for liver, to help with the process of finding a living donor. So when people are approved at selection, that's when I reach out and we get the ball rolling. They've already heard a great deal at their evaluation. They've already received a bunch of materials on how to find a living donor. Some of them hit the ground running, but the majority need a little bit of hand holding. So I call them and we talk through, again, the benefits of transplant from a living donor and how to put the message out there, how to work with family and friends, what methods to use. A lot of times they're finding themselves very overwhelmed. They might be concerned with really putting this message out there. And so we try to talk through that. And at this point, I also schedule them for a 90-minute online training session. I'm cold calling people. I know that they might have divided attention at that time. And so I want to give them a brief overview, but also set aside a long amount of time to really go into the ins and outs. So we have our online trainings that we do. We have toolkits, handouts, examples, sample wording that they can use. We put on workshops quarterly. We also started a mentor program. I was a living liver donor last year, and I really wanted to talk to somebody first who had been through that process. So I reached out and found a mentor through UPMC, and it was a fantastic way to just kind of talk through the behind the scenes process. I'm here as a resource. We have a champions website. We have our social media support group. And here are some images. I know this is a really busy slide, but on the left, you can see the business card that we hand out to everybody on the list. We want anybody on the list to have a stack of these with them at all times. If they're out and about, we want them to leave some at the checkout counter. We want them to drop some off at their bank, at their dentist. If they're running into an acquaintance, we want them to hand out this card. So we have a lot of different resources that we share. We started doing this program in 2019, this one-on-one support. We've seen a 71% increase in people who participated having living donor registrations. And those registration numbers climbed 260%. Now, unfortunately, registrations don't necessarily translate into transplants. Many people are declined for transplant because of high blood pressure, diabetes. I'm sorry, not transplant, for donation. Because of diabetes, high blood pressure, BMI, there are a lot of factors that preclude donation. But we have seen a 3% growth. So, modest, but we're happy that, every behind those statistics are real people. So we're going in the right direction. I also pulled our national data from OPTN over that same period of time. And living donations have fallen from across the country, about a 7% drop. And so there's a lot of potential, right? There's a lot of potential for growth. Now, Bobby asked that I close out with some advice. So here's what I would say. If I'm starting this process and I'm meeting with transplant centers, I would ask how many transplants they do every year and the percentage of those transplants that come from living donors. So I would want to be somewhere that's very experienced and where living donations kind of their bread and butter. Because that shows that both the medical team has a great deal of expertise, but they also have a lot of support in place to help people with their donor search. Once I was listed, I would never give up. I know I talk to a lot of people who say that they already have a donor, or, hey, everybody already knows that I need a transplant. Yeah, but they might not know how to register. They might not know that living donations is even an option. They might think that the waiting list takes a few weeks, so then you get your transplant, but sadly, that's not the case. And then I would stay in touch with my transplant coordinator every step of the way. That is your go-to person. Our team wants to hear from you, whether you are going through the evaluation, you're on the waiting list, or you're post-transplant. So questions, concerns, anything a little bit weird, call your coordinator, let them know what's going on. I'm a note taker, so I would keep detailed notes in a safe place, keep them all together. And we know that outcomes are so much better if people listen exactly to medical advice. So they attend all their follow-up appointments. They take all medications exactly as prescribed. They get their lab work done. It's really not just to make your life difficult and make you jump through hoops. Data's shown that the outcomes are just that much better. I welcome anyone. If you have questions along the way, you're always welcome to call, text, or email me. Hopefully, I can lend some support. I'm here as a resource, and I appreciate again Bobby Shoba, the Kidney Stories Toastmasters, for having me share today. All right, thanks so much.
Thank you so much, Cherie. That was really, really great. We are going to talk more about this throughout the day, and I'm sure you'll be hearing from people as well. We have had a question or two come in, but I'm going to hold off on the questions until after we have our next speaker talk and do her presentation for this first portion of our program. Our next speaker is going to be Ann Paschke. Ann has managed media relations at the United Network for Organ Sharing for over 24 years. And over that time, she's come to care deeply about many transplant recipients, donor families, members, and living donors. This led her to finally fill her dream of becoming a non-directed living donor last year. She lives in Richmond, Virginia, with her husband and her 4 dogs. Anne, could you enlighten us more about UNOS and your experience with that to help us along our way? Thank you. Welcome, Anne.
Thank you, Bobby. It's so wonderful to be here. And like Cherie, I really appreciate the invitation and I'm excited to share with you all. So I'm going to pull up